Hello, I'm Laura Fischer, and I'm going to be doing my physical assessment head to toe exam on Austin here. So first, I would walk into the room and introduce myself to the patient and wash my hands in front of them. I would want to assess his chief complaint. So today he's here for a well visit, and then I would want to make sure that he's alert and oriented times 3. So what's your name?
Austin Fischer.
And what date is it today?
16th of March.
It is. And where are we?
Home.
Good. Okay. So he's oriented to person, place, and time. His cognition, I would ask him simple questions. Does a rock float on water?
No.
No. And his behavior is appropriate for this setting. So I would also have the medical assistant assess his vitals and his height and weight before he would have gotten here. So I already have that information that I need. And I'm going to start my head to toe exam. So first I will start by looking at the skin on his face. I can see that it's intact and there's no lesions anywhere. His skin looks clear. He has appropriate facial hair. I'm going to inspect his scalp. So I'm looking at his head and his scalp. His hair is evenly distributed. There's no infestations. His scalp feels good. Is there any tenderness?
Nope.
Good. That all looks good. So now I'm going to look at his face. I'm going to assess trigeminal nerve 5. I'm going to have you open your mouth and close your mouth and clench down and then move your jaw side to side. Good. Okay. Now I'm going to have you smile at me. Good. Raise your eyebrows. Puff out your cheeks. Keep them puffed. Good. That's facial nerve. The facial nerve, which is cranial nerve 5, and that's intact because everything was equal and symmetric. That looks really good. Now I'm going to start assessing your eyes. So I'm going to look at your eyes. You can leave your glasses on. I'm inspecting the conjunctiva and seeing that the conjunctiva is pink. There's no lesions. They look good. The sclera is white. His eyelashes on the top go up and they go down on the bottom. And I'm going to palpate here on the lacrimal ducts. There's no drainage or anything there. Those look good. I'm going to take my pen light and look for the corneal light reflex. So I'm just shining, and I can see the reflection of the light here on the nasal side of his eye. So that's good. I'm going to look for his pupils. So I'm just going to see his pupils are equal, round, and reactive to light. I'm going to check the accommodation. So stare at my pen light for me. Follow it into your nose. Good. And the accommodation is intact as well. While I have my pen light out, I'm going to assess cranial nerves 3, 4, and 6, which look at extraocular eye movement. So if you can just follow my pen light with your eyes. Good. Good. Wonderful. So I think I'm done with my pen light here. I'm going to take this and I'm going to have you look over my shoulder here. I'm just going to do the cover on cover test. Good. And that's just looking for any extraocular movements or abnormal movements of his eye, which I do not see, so that is normal. I'm going to take my ophthalmoscope here. I'm going to shine. So when I'm doing this, try to look right over my shoulder, okay? I'm going to look and find the red light reflex. Able to observe the vasculature of his eye and the optic disc with clear margins. Good. Then do it on the other side. Try to look right at me. Look over the shoulder for me. The red light reflex, look over the shoulder. Follow it in here. I see the vasculature and the optic disc with clear margins. I'm now going to assess your ears. So I'm just going to look at the ears first of all. They look symmetric and they are in line with the outer canthus of the eye, so that's good. I'm looking at the pinna and the tragus. Any tenderness?
No.
And they look good. There's no lesions anywhere on the ear itself. I would also have the medical assistant assess cranial nerve 8, which is the acoustic nerve, doing the whisper, Weber, and ring test. You been hearing okay?
Yeah.
I'm getting my ophthalmoscope ready, or otoscope ready here. Okay. So I'm going to just pull your ear up and back. I'm looking inside here. I can see your tympanic membrane. The canal looks good and intact and clean. I see the cone of light at 7 o'clock, which is your left ear. I'm going to do the same on this side. Okay, I see the tympanic membrane and the cone of light is at 5 o'clock. Good. Now moving on, I'm going to take a look at your nose. I would have the medical assistant, or no, I would assess if you've been having trouble smelling anything, like you smell things okay?
I smell just fine.
And I could also assess with some essential oils or some type of oil to assess his smelling capabilities to see if he can identify scents like lavender or chocolate or lemon. And then I'm just going to look at his nose. I see that it sits symmetric on his face. The skin over his nose looks good. I'm going to kind of palpate here, sorry. The bridge of his nose, the soft tissues, any tenderness. And I'm feeling the sinuses here, both maxillary and ethmoid, anything there, anything. I don't feel any swelling or anything of the nose or the sinuses. So I'm just going to end up in your nose here. Okay, so I'm just going to look inside here. I don't see any polyps. The septum looks intact and pink and moist. Turbinates are visualized. Okay, so now I'm going to look at your mouth. So I'm looking at your mouth. It's symmetric as it sits on your face. Your lips are intact. There's no scaling or dryness. Your lips look good. I've noticed throughout this exam that the way that he speaks, he's able to articulate his words. So I know that his hypoglossal cranial nerve is intact. And he's able to speak to me clearly and concisely. I'm going to have you open your mouth for me, please. I'm going to use my pen light. And at this time, I would assess if he had any breath odor, halitosis, or any sweet smelling breath. And I don't notice any of that. I'm looking in his mouth here. I see that he has all of his teeth, and the buccal mucosa looks good. It's pink and it's moist. Can you stick out your tongue for me so I can assess your tongue? I see that his tongue is able to protrude midline. Open again, sorry. Looking once more, I can see the hard palate and the soft palate. The hard palate is fused. The soft palate is pink and moist. Can you say Good. And by that, I was able to visualize his tonsils. I would grade them as a 2+. By his ability to say and I saw his uvula midline, I would also assess his gag reflex at this time. And that assesses cranial nerve 9 and 12, which are the glossopharyngeal and the vagus nerve. So I'm going to move on now to your neck. So I'm going to have you assess the range of motion of your neck. So I'll have you look up and look down. Good. And side to side for me. Any pain or anything. Okay. And I see that you have full range of motion. I'm going to assess spinal accessory nerve, which is cranial nerve 11. So I'll have you push up against my hands. Good. And then turn your head against my hands. And this way. Good. Good strength. Now I'm just going to assess his neck. So I'm looking at the skin on his neck. It's without lesions and it's symmetric. I see that his trachea is midline, which is normal. I don't I don't see any jugular venous distension. If I was worried about it, and I can assess later on in the exam when he's laying down to further assess for that distension. I'm going to palpate one at a time his carotid arteries. Good. And I'm going to auscultate for any bruits. I don't notice any bruise there, so that's good. I'm also going to palpate his neck here and his lymph nodes. So I'll assess the preauricular and the postauricular, the submandibular and submental, and then the anterior and superior cervical, superior clavicle here, and the posterior cervical chain. Good. And then to assess, to see your thyroid, I would have you stand behind you here. I'm just going to have you swallow. So swallow for me. Good. And I don't palpate the thyroid tissue, which is normal. Now I'm going to move on to your upper body here. I'm going to look at the skin. So you have a gown on so I can see better, but I look at your clavicles, the acromion process, and your scapula here. So I see that everything is symmetric and intact. I'm going to palpate the acromion process. Any pain? No. Good. Okay. And then I'm going to just work my way down your arms here. So I'm going to assess. The range of motion of your shoulders. So if you could just do what I do, and if you could do flexion, so your arms up for me. Good. And extension, if you can go back behind you, if you can when you're sitting. Good. And then abduction away from you, out and away. Good. And then one at a time, adduction over you. Good. And then this one is a little bit harder, internal rotation. So take your thumb and put your thumb in the middle of your back. Good. Both sides. And then up and outward, external rotation. Good. And on the other side. Good. And then we'll do range of motion of your elbows. So we're going to do flexion out. And extension out, flexion in, good, and then go out and supination, palms up, junior palms down, pronation, good job. We're going to look at the range of motion of your wrist at this time, so if you could please go down, extend, and up, and flex, good, and outward, and inward, and then hands, if you just wiggle your fingers, move your fingers out, and try to push against me, good, and then push them together, good. I'm going to test your hand grips here, so if you could grip my hands for me, please. Good. So you are strong and equal bilateral there. I'm also going to assess while I'm right here. Just going to check your pulses. So radial pulses are palpable and present, and so are the brachial. And then I'm just going to assess calf refill on both sides. Good. So now I'm going to do your deep spinning reflexes. I'll do one arm and then the other. I'll do your biceps here. Break your radial. Good. I'm going to do your triceps here. Try to totally relax into the arm. Good. This side. I'll have you relax. Just like that. Perfect. Sorry to pull your arm. Good. I'm now going to work my way down to your chest. So I'm actually going to go behind you. If you can kind of turn like this for me. I'm assessing his posterior chest. First, I'm looking at the skin, looking to make sure everything is symmetric back here, which it is. I'm looking at the shape of his thorax. It's a 2-to-1 ratio, so his thorax is wider than what it is deep. I'm also looking at his posture and how he presents himself here. I'm going to percuss his lungs. So I'm listening for resonance throughout his lung tissue. There's no dullness. Good. And then if you could please take a big deep breath for me. Good. His chest expansion is equal on both sides. I'm going to do some tactile premises. So Austin, whenever you feel me move my hand, please say 99.
99. 99.
Little louder.
99. 99. 99. 99. 99. 99.
Good. And now I'm going to have you do the same thing this time. Every time I move my stethoscope, please say 99.
99. 99, 99, 99, 99, 99, 99, 99.
Good. Thank you. So that was my vocal premise, and the sounds that I were hearing were muffled and not clear to me, which tells me that there's no fluid in his lungs. And so now I'm actually just going to listen to his breath sounds themselves. So you can just breathe normally, and every time I move my stethoscope, take a deep breath. So just to describe what I was doing in the back there, I was looking at a ladder formation across all lung fields, including the lateral aspects of his lungs, specifically that right middle lobe on his right side. All lung sounds were clear, no wheezing, no round cry, nothing of that sort. Oh, excuse me. I'm gonna come around to the front now. I'm going to listen to lung sounds in the front, so try to just breathe normal for me. Now I'll move on to my cardiovascular assessment. So I'm going to listen to your heart so you can just breathe normal, okay? I'm going to listen with both sides of my stethoscope. So S1 and S2 were heard throughout all areas of his heart, which was the aortic, pulmonic, Erb's point, tricuspid, and over the mitral area. So all places were positive for S1 and S2. No murmurs, no regurgitation was heard. I'm going to have you sit up real straight here, Austin, and I'm just going to try to find and localize, if I'm able to see it, the point of maximum impulse, which I'm at the 5th intercostal space, mid-clavicular line. And I do feel it, which is the apical pulse here that I'm palpating. Good, okay. So I'm going to have you lay down now. And then while you're laying down, I'm also going to listen to your heart sounds again, okay? Try to just breathe normal. Okay. So I've just listened to, again, aortic, pulmonic, Erb's point, tricuspid, mitral area, S1, S2, both heard and present. And as I'm looking at him now that he's lying down, I see that there's no jugular venous distension. Now moving on to his abdomen. So I'm looking at the skin on his abdomen and his chest at this time. I would kind of pull up the gown so that I can see his skin. I'm looking at the contour of his stomach and the shape of his stomach for any bumps or bruises. First, I'm just going to inspect, and then I'm going to auscultate. So I'm listening to all 4 quadrants. Normal active bowel sounds in all 4 quadrants. I'm now going to lightly palpate in all areas. Any pain or tenderness with any of this? No. Palpated all four with light to moderate palpation here. I'm also going to check for rebound tenderness. So tell me if I press and let go, any pain? And then over McBurney's point here, any pain here? So I am now going to percuss all four areas. Hearing sounds of timpani. Good. I'm going to percuss his liver now, so I'm going to go from bottom up, listening for when I hear dullness, which is right here, and then top down. Okay, so I have found the area of dullness here, so I have located and palpated or percussed the liver. I'm going to try to palpate the liver now. Any pain there? It's within normal size and not inflamed or tender. I'm going to now percuss for the spleen, so I'm going to go to the lowest intercostal space. I find dullness, so it's been spleen is percussed, and now I'm going to palpate the spleen, which I do not feel, which is a normal finding. I'm going to work my way down. I'm going to auscultate for the vasculature of his stomach, so I'm listening to the aortic, renal, iliac, and femoral arteries, listening for bruit. No bruits are hurt. At this point, I'm going to try to palpate for his kidneys. So I'm going to tell me if this hurts. Sometimes this hurts. And actually, I'm not able to palpate him. All right, so working my way down now, I'm going to look at your hips. So I'm going to feel the anterior aspect of your hips. Good. And I'm going to push. Any pain here with your hips? No. I'd like to look at your range of motion. So if you could please pull your knee into your belly, like pull it up. Good. And then on this side. Wonderful. Good job. And then if you could pull your leg out and away, abduct your leg on both sides. Good job. And then pull your leg up and over. So abduct to your body. So across. Sorry. Up and over like this. Good. Yep. All right. And then up and over this way. And then are you able to lay on your stomach real quick? And then while you're laying here, if you can just lift this leg up. Good. And this leg up. This is extension of the hip, which is intact. So go ahead for me, Austin, if you could sit on the edge now. Come back. Good. I'm going to inspect and look at his knees now. So I'm looking, when I look at his knees, just for the positioning of them, the skin on them. I'm going to inspect all of his leg here, the shin, his ankles, and his feet. Looking for lesions, abnormalities, any masses of any kind. I'm going to look at his knees to test their range of motion. So if I can have you straighten your legs out, good. And then bend them down, that's flexion and extension. If you can try to hold this part still and move your leg away and towards you, good. And away, towards you, good. So that's abduction and adduction. Same with your ankles. So point your toes up, point your toes down, good. And then you can go outward to tip your heel in. Good. Heel out. Oh, you can't see that. He's doing it. And then I'm going to check your reflexes here. So I'm just going to check your patellar and your knee. Good. Good. And then I'm going to check your Achilles. Good. And then the plantar. Good. Tickle? Mm-hmm. Good. Okay. So all deep tendon reflexes have been assessed and they are normal reflexive. At this time, we've done range of motion and reflexes. I think I will have you stand up if you can, and I'll have you go over that way, and walk towards me. Good, so I'm just assessing his gait and his posture. Now walk away from me on your heels. Good, and walk towards me on your toes. Good, and then can you walk away from me heel to toes and tandem walking? Good, okay, and then if you can come stand back in front of the camera. If you can, I'm assessing for ataxia, so if you could take your heel and slide it up your shin on one side, good, and on the other side, good. So there's no ataxia seen in his lower extremities. I'm going to have you stand up nice and straight for me going on the counter and close your eyes. And do you feel dizzy or feel like you're moving? So that's the Romberg test, and he passed that, so that's good. I'm going to assess your spine now. So I'm looking and palpating his spine. I'm going to have you swan dive. So if you can put your arms up and kind of lean forward. I'm going to palpate the vertebra here. Good. There's the normal curvatures of the spine. I don't see any abnormal curve. And then I'm going to assess the range of motion of the spine. So if you could try to touch your toes, so lean down, you don't have to, but touch this part. Good, good. And then go ahead and stand up and now lean backwards. Good, wonderful. And then if you can laterally bend, so bend to your left and then to your right. Good, and then rotation, so kind of turn your back. Good. Turn your back that way. Wonderful. All right, you can come back up here and sit down. Boss you around. So I was assessing him as well for any pronation of his legs, any pigeon-toed or bow-legged. He is not everything. Nothing was pronated, either his hips, knees, or ankles. Now I'm going to discuss some of the neurological exams that I would perform with Austin. So I would look for exteroception. So this would be if I had a tongue depressor or something soft and dull, a Q-tip, I could assess if he feels the difference between a sharp and a dull feeling on his extremities, arms, or legs. I would assess him for proprioception, so that would be him closing his eyes, and I would lift up a finger or a toe, and he would be able to tell me where he was in space, so if his finger was up or if his finger was down. And then I would also want to assess the cortical aspect of his sensation, so that would be having him stand with his eyes closed. I would put an object like a key in his hand and have him tell me what that is. So identify that object. Graphesthesia, so I would have him open his hand and close his eyes, and I would trace a number or a letter in his hand, and he would be able to tell me what that was. There's also 2-point discrimination, so I would be able to touch him in with a bobby pin or a pin of a paper clip, and he could tell me if I was touching him with one object or two objects at the same time. And then there's also the extinction. So that would be if I have him have his eyes closed and tell me if I'm touching him on either side of the leg, the lower aspect of the leg, the arm, the face. And I think that sums up my head to toe assessment. Thanks.